I've been practicing chiropractic for over 40 years. My goal is to help people, and I found that non-surgical decompression is a way of doing that. I saw patients coming in with disc surgeries that were not successful and still having a lot of pain, and I saw the value of non-surgical spinal decompression as a way to help those people. Non-surgical decompression is an advanced technology that is being used to use a distraction force, a vacuum effect, if you will, onto the nerve that's creating low back or neck pain. It works by creating a negative pressure, which is like putting a dry sponge in water, and the water gets sucked in there. It's just vacuuming that disc material back into the disc along with water, nutrients, and oxygen to actually patch the hole that's in the disc.
2 years ago, I had a slip and fall down a mountain and had a bulging disc in my lower neck. I was just agony all day, all night. Multiple doctors that I've seen just wanted to do surgery, and Dr. Tucker, he had great results with other people with the decompression machine. And within the first week, I went from 10 on the pain scale down to about a 2. And within 2 to 3 weeks, I was down to about a 0. And pretty much have been pain-free without having any surgery or anything else.
At my office, we use the AcuSpina decompression unit. It is the most heavily researched machine out there. It has several options that are not available on other tables. We use the AcuSpina machine because of its effectiveness. It's 92% effective. Safety is a key thing at our office, and it is the safest procedure available rather than doing surgery. The reason it's important to do non-surgical decompression is because the effects of surgery are drastic. Patients miss a lot of work, they are on a lot of medication, they do a lot of physical therapy, and with non-surgical decompression, there's none of that. When the AcuSpina has a 92% success rate, and when you're looking at surgery, the success rate according to the American Journal of Medicine is 50%. When the AcuSpina has a 92% success rate, there's no complications at all.
Around 6 years ago, I went to work and my legs gave out and I fell to the ground. I had 3 bulging discs. It was bad. I came to see Dr. Tucker because he has this non-surgical disc decompression machine. It was so comfortable, no pain, and most of the time I fell asleep. I can now walk. I have no pain. When I saw Dr. Tucker, it was around 2016, and here we're in 24. And I have been fine ever since. I would say that anyone that is having back or neck pain, that his non-surgical decompression machine is fantastic.
The most common symptoms that we treat are people that have arm and hand numbnesses, tingling, pain. We also treat sciatica, leg pain, numbnesses in the feet. Spinal decompression treats patients that have tried the normal realms of medication, physical therapy, chiropractic, acupuncture, or steroid shots. It helps people with a disc issue, a herniated, a ruptured disc, bulging discs, people that have degenerative disc disease. It works well on patients that have been told they have to have surgery, they don't want to, or they've been told there are no other options. So if people are experiencing pain after surgery, and it's been longer than 6 months, we can still do non-surgical decompression work. As long as you haven't had any hardware implanted, it works very, very well for that.
Spinal decompression, it literally changed my life. Basically, after different kinds of activities, my low back would be really sore. I could never figure out what it was and just wanted to get some relief. Dr. Tucker was a really down-to-earth, caring person. Took the time to really figure out what was going on and how it affected my life. Some of the activities that I've started doing again, running, lifting at the gym, simple activities that always kind of plagued me, I didn't even pay attention to back pain because it wasn't there anymore. It's kind of hard to express to people how effective it is. You just got to try it.
When someone comes in for non-surgical spinal decompression, we sit down with them, we go over their MRI reports, we go over their medical history, we show them the pictures of the bulging discs, we work up a protocol that works for them. A session on the spinal decompression unit takes about 30 minutes. The number of sessions depends upon that consultation. The decompression process that the patient goes through is very comfortable, it's very relaxing. We lay the patient down on the table. We create a distraction, a negative pressure force that they barely feel. Most patients fall asleep and they wake up and they're better. So if you're still in pain from a herniated or bulging disc, call the office, set up a free consultation with us. We'll sit down with you, go over your medical records, and at Tucker Chiropractic, we'll work up a protocol that'll work for you.